We are back for another Monday Masterclass. This one is going to be a topic that I will tell you has been obviously 30 years in the making for sure. And then let's also include that information like this is what I'm being told is not shared in high school, not shared in college, but is requested because the reason why it's being requested is because this information would be helpful for them when making decisions in life. So there you go. I want to thank you all so much for being here. And I will tell you, this is not medical advice. This is not political advice. This is not spiritual advice. This is not anything to debate. This is information that is what I'm presenting. And if you feel like you have something different, take notes. If you feel like you have something that you want to talk about during your appointment with me, take notes, put it in the comment section. Let's have a conversation. So, my name is Connie, and I am a Bachelor of Science degree multi-state licensed registered nurse. I have been doing women's wellness for 30 years and I love being a nurse. I love doing what I do. And I really think that today is just going to be us going back to the basics. So, and I really mean like the basics because I've noticed something happening online. It's that digital waiting room, and it's actually extended outside of the digital waiting room, so much so that it is impacting every single social media outlet that you could find, whether it's Reddit, whether it's Facebook or TikTok or Instagram, YouTube, it doesn't matter. This is something that I have noticed um, being a growing need for information for quite a while. So, people are having very passionate conversations about pregnancy, miscarriage, abortion, fertility, embryos, fetuses, ectopic pregnancies, and reproductive health. I would love for you to put in the comments um, when was the last time you had reproductive health education? And if you're older and you're like, we got that whenever we were in school. If you are younger and you're like, what in the world is that? Or if you are, it doesn't matter either way, either age, you could have the same answer. If you feel like, wow, you know what, I didn't really feel like I knew about my body until I went to my OBGYN. Or maybe you didn't know anything until you read a book. So how did you get that information on reproductive health? And what are your thoughts on where is is the doctor's office best? Do you feel like there was a book? If you're an author, I know y'all are going to plug in your links, but I will tell you, I vet you. If you are in the comments and you make a comment and you are absolutely a scammo, I will scoot you right on out of that comment section because this requires perfect vetting for people who want honest answers. Like, what is an egg? What is sperm? What exactly happens during fertilization? What is a zygote? What does an embryo look like? When does an embryo become a fetus? When does pregnancy actually begin medically? And why might someone say that they are like 6 weeks pregnant when fertilization happened only about 4 weeks ago? Yeah, we're going to dive into that. It's not meant to be a head spinner. It's actually meant to be like a head scratcher and being like, what? There's like a difference? Yes, there is. Because those sound like simple questions to me. To you, they may be perplexing. But if you've never been taught reproductive biology clearly, they're not necessarily simple at all. I'm going to tell you, my kids right now, they get this information. We talk about it. It is age appropriate. It is something that is, I don't feel like everybody has to have a nurse in the family just to have this conversation. You can obviously plug and play this in your homeschool. I've been asked so many times for this information for communities that feel like they just want more than maybe what's given in their education system. So here we go. All right. So today we're taking politics off the conversation table. Okay. We're taking social media arguments out of the conversation. We're simply going to learn. So this is Pregnancy 101. My goal today isn't to tell you what political position to hold. It is to make sure that you hear these words clearly. You understand what they mean biologically and medically. Because before we can have complicated conversations about reproductive health, we need common vocabulary. So let's start at the very beginning, as all stories do once upon a time, right? Okay, so what is an egg? People commonly call it an egg, but you'll also hear healthcare providers, healthcare professionals, healthcare, those in the healthcare system use the word oocyte. Oocyte. An oocyte is the female reproductive cell. A woman is born with the immature oocytes she will have available during her entire lifetime. During the reproductive years, the hormones coordinate the menstrual cycle, and typically one dominant follicle develops toward that ovulation during a menstrual cycle. At ovulation, an oocyte is released from the ovary. There's two of them. Which one is it? There you go. You have a right and a left ovary, right? Anyway, let's just not dive into that yet because there's going to be a part two. And here's something important: an unfertilized egg is not an embryo. It's not even a fetus. And it isn't even a pregnancy, but it is a reproductive cell. Now, the mature human egg contains 23 chromosomes. Now, let's talk about the other half. What is sperm? Sperm is the male reproductive cells. They are produced in the testes. Okay. And a typical sperm cell also contains 23 chromosomes. An egg by itself does not become an embryo, and a sperm by itself does not become an embryo. For sexual reproduction to begin, genetic material from an egg and sperm must come together through fertilization. So now let's talk about what happens when they do. What is fertilization? Ordinarily, it occurs in a fallopian tube, not inside the uterus. That's something a lot of people don't realize. I heard someone say that the other day, and I was like, okay, so yep, good thing Monday Masterclass is coming. Here we go. And it actually came from a male. I do appreciate that he did try to maybe use words of the female anatomy, where, yeah, I just appreciate it, but this is why we're having this conversation. Okay. So after ovulation, the oocyte enters the fallopian tube of the one connected to that ovary. Okay, so if it's from the right ovary, it's the right fallopian tube. If it is the left ovary, it's the left fallopian tube. If the sperm, if there is sperm that is present and one successfully penetrates, goes through, and it fuses with the egg, their genetic materials combine. At that point, something new exists biologically: a zygote. The zygote is the first single cell developmental stage produced by fertilization. So the egg contributed 23 chromosomes, the sperm contributed 23 chromosomes. The resulting zygote ordinarily has 46 chromosomes arranged in 23 pairs. And that combination, it contains a new genetic mixture. It is derived from the two biological parents. Now, here's where I want to be very precise. Biologically, fertilization marks the formation of a new human organism at the zygote stage. But when people ask, when does life begin? They may actually be asking several different questions. This is where my brain goes, right? There are quite a few things that I'm going to list off that I think, that we're having this conversation. When does life begin? Okay. These are the questions that I think that people are meaning. When does a new organism form? When does pregnancy medically begin? When does an embryo have a heartbeat? When can a fetus survive outside the uterus? When does legal personhood begin? Or when does moral or spiritual personhood begin? Yeah. Those are not all the same questions. So when you ask, when does life begin? Just know that someone like me is thinking in my head, well, which one? Which one are you talking about? Science can describe fertilization and human development. Medicine can define and manage pregnancy. Law can establish legal rights. Religion and philosophy, they may address moral or spiritual meaning. Those categories shouldn't be quietly substituted for one another. So for today's class, we are learning the biology. What happens to the zygote? Now, now we have a zygote, but it doesn't stay one cell for very long. It begins dividing quickly. Okay, I'm talking so fast. Okay, one cell becomes two, two becomes four, four becomes eight. And those cells, they continue dividing while the developing organism travels through the fallopian tube toward the uterus. So during this early development, it passes through stages that include the morula and then the blastocytes. That's my favorite part. That's the thing that we're talking about, right? So you don't necessarily need to memorize all of these words, but I do want you to understand the journey. Fertilization generally occurs in the fallopian tube. Then early cell division occurs. Then the developing blastocyte reaches the uterus. And then something very important must happen. Implantation. Okay? Implantation. The blastocyte must attach to and begin embedding in the lining of the uterus. And oh, is it sticky, right? It should be sticky, right? That process is called implantation. So this distinction is going to become extremely important in next week's class when we discuss ectopic pregnancy. Because location matters. The uterus is designed to expand tremendously during pregnancy. Remember those hormones, right? A fallopian tube does not. It is not designed to expand tremendously during pregnancy. So keep that thought in the back of your mind. We're going to come back to it next week, okay? Now, when does pregnancy begin? This is another place where everyday language and medical terminology, it can become confusing. I'm shaking my head. Yes, this can become so confusing. Fertilization and pregnancy dating are not the same thing. Clinicians typically calculate this thing called gestational age, beginning with the first day of the last menstrual period. Why? Because most people cannot identify the exact moment fertilization occurred, unless you had this other procedure. Okay, then you know. So while the first day of the last menstrual period is often easier to identify, then we can answer that question. Okay, or have a roundabout of a few dates. So in a textbook, right, you will see 28-day menstrual cycle. Oh, ladies, I know you're already telling me mine's this and mine's that. But okay, so let's just talk about textbook. And I also agree that not every woman is textbook, and I would never throw that out there, except for if I'm just trying to make this general conversation. Okay, or this general education so that we can all find something to cling to. Okay. So, but in that textbook 28-day menstrual cycle, ovulation and fertilization, they might occur approximately 2 weeks after that first day. So, someone can medically be called 4 weeks pregnant, even though fertilization occurred approximately 2 weeks earlier. That doesn't mean anybody is adding two imaginary weeks to the embryo. It's simply the dating convention used in obstetrics. So this distinction, it does become extremely important when you're reading headlines saying 6 weeks pregnant. Are we talking about 6 weeks of gestational age or 6 weeks since fertilization? Because those aren't exactly the same developmental point. So knowing that one fact, it can actually make reproductive health conversations much easier to understand. We're going to talk about zygote, embryo, fetus. This, look at this picture that's up here, right? It's egg, sperm, zygote, blastocyte, embryo, fetus. Okay, so what we're talking about is the zygote, embryo, and fetus. And I do want to clear up another common source of confusion, okay? Because these terms describe different stages of prenatal human development. So a zygote describes the earliest stage following fertilization. So after further development and implantation, we use the term embryo. And then the embryonic period, it is a tremendously important period of development. So major body structures and the organs, that system, it begins forming. The heart and circulatory system develop. This is another reason why I talk to my clients about specific supplements at a specific time of when you are trying to get pregnant. So this is why this is so important, because these dates are they can be confusing. Okay. So, but because that neural tube development, yep, it develops into this structure that will become the brain and the spinal cord. And then limbs begin developing, and the body plan becomes increasingly recognizable. It looks like the gummy bear, right? The gummy bear in the ultrasound. So, around 9 weeks after fertilization, terminology changes again. So now we use the word fetus. Fetus development continues from approximately the 9th week after fertilization until birth. The fetus grows. Organs continue maturing. The nervous system continues developing, bones and muscles develop, movement develops. I mean, they learn how to use their spinal cord to move their different limbs, and then different development continues through pregnancy. All right. So here's our timeline: egg and sperm, fertilization, zygote, cell division, morula or morula, however you want to pronounce it, blastocyte, implantation, embryo, fetus, birth. These aren't political terms, they're developmental terms. So, is a fetus a baby? Now we're getting into language that causes enormous arguments online. Someone will say that's a baby. Someone else will say, no, that's a fetus. And then they'll argue, they'll argue as though like one word makes the other impossible. So medically, fetus is the developmental term used during a particular stage before birth. Baby. It is an ordinary language term rather than a precise embryologic stage. So parents commonly call a pregnancy their baby, and healthcare professionals may even conversationally say your baby while documenting fetus in the medical record. So those things aren't necessarily contradictory. What matters in medical education is knowing what term identifies which developmental stage. When does the heart begin developing? This is another subject where online language can become misleading very, very quickly. The cardiovascular system, it begins developing very early during the embryonic period. Early cardiac tissue, it begins rhythmic activity as the development progresses. But an early embryonic heart is not automatically identical to a fully developed newborn heart. That's why phrases such as heartbeat can become confusing when they're used without explaining the developmental stage. Again, we don't need to exaggerate the biology. The biology itself is fascinating enough. Development happens gradually. Structures form. They differentiate, right? They grow and they mature. So does every fertilized egg become a baby? No. This is another important piece of reproductive biology. Not every fertilization results in a recognized pregnancy. Some developing embryos never successfully implant. Some pregnancies end very early. Chromosomal abnormalities are a major reason early pregnancy losses occur. Sometimes pregnancy loss happens before someone even realizes conception even occurred. And this brings us directly towards next week's topic, because the word abortion has a broader medical history than many people realize. A miscarriage has traditionally been medically called a spontaneous abortion. If you look at the medical chart, the medical sheet that you fill out, and if it asks you how many abortions have you had, and you don't see anywhere on there where it says spontaneous abortion, if you want, and you could and you should, if you had a miscarriage, you can put spontaneous abortion times one, times two, times three, right? You can do that on your medical sheet. That's your information. So, but I'll tell you that a spontaneous abortion, it does not mean someone intentionally ended the pregnancy. It describes spontaneous pregnancy loss. So next week, we're going to slow down and we're going to unpack those terms super carefully. I do want to talk about why location matters. Because before we finish today, I want to introduce one more concept if you don't mind. Now remember, where I said fertilization normally happens, the fallopian tube, where does that happen? The fallopian tube fertilization, right? And then what is supposed to happen? The developing blastocytes travel toward the uterus and they implant there. Think about them just kind of digging in and having that sticky stuff implant them. And it's like we're camping out, right? Well, occasionally implantation happens somewhere it shouldn't. Most commonly, that is inside the fallopian tube. That is called an ectopic pregnancy. This is where reproductive health becomes an emergency medicine. An ectopic pregnancy cannot develop to a viable birth in a fallopian tube. The tube cannot expand the way that the uterus can. If the pregnancy grows there, the tube may rupture, and that can cause a life threatening internal bleeding. And unfortunately, current medicine cannot take an implanted tubal ectopic pregnancy, remove it, and transplant it into the uterus. If you want to ask all the people that have a bazillion dollars, ask them what they got cooking on that. Okay. Ask them those questions. Okay. So this is why treatment can be necessary, even though the pregnancy may have been very much wanted. We're going to spend significant time on that next week because I think people deserve to understand it. So, why in the world am I teaching this? You may be wondering, Connie, why are you talking about this on a wellness channel? Well, because it's health education. I get asked about this a lot. I'm not in the clinics. I don't work in a clinic. I don't work in a space where anybody would get to have constant access to me in a medical office. I don't sit in there in an office where people can ask me these questions, okay? But I will tell you that people shouldn't have to learn basic reproductive biology during a medical emergency. A teenager should know these words. A college student should know them. A 35-year-old woman should know them. A man should know them. A woman should know them. Someone trying to get pregnant should know them. Someone who never wants children should still understand how human reproduction works. Knowledge does not force you to adapt to someone's political position. No. Knowledge gives you the vocabulary to understand the conversation. Remember when I was talking about the gentleman? Yeah. So hopefully somebody sends this to him. So now that's what I want to talk about on that for in this master class, this Monday master class. It is about you understanding the vocabulary, you understanding that you have a space. You have a space where you can ask, wait, what does that actually mean? That is what I provide. That's what Monday Masterclass is. That is what the women in the membership after this Monday Masterclass, they have access to this. So they get to ask me the questions that aren't live and online. You're not going to see those questions. You never will. You never will unless you attend a Monday Masterclass and you're hearing women and people and men and ask questions, right? I don't want anyone to be made to feel stupid for asking a question. Because to me, you know how they always say, like, the only stupid question is the one that's not asked. Well, I'll tell you, it is it can be quite embarrassing to know that, like, oh my gosh, 35, and I can't believe I don't know this, but I've got a question. Well, what's the question? Let's talk about it. What do you want to know? Like, that's what Self-Care University OK is all about. This is a collective amount of information that your doctor does not have time to go over during the 15 to 20 minutes that the insurance gives them for your appointment. Okay? So, well, let's close this thing up with a review. An egg or oocyte is a female reproductive cell, right? Oocyte, oocyte, whatever y'all want to call it, but we call it an oocyte. A sperm is a male reproductive cell. When egg and sperm successfully fuse, which is fertilization, that's when that occurs. The resulting single cell stage is called a zygote. The zygote divides and progresses through early developmental stages while traveling toward the uterus. Now, a blastocyte normally implants into the uterine lining, the squishy, sticky area that I keep talking about. Development then continues through the embryonic period. Beginning around 9 weeks after fertilization, we use the term fetus. And clinicians usually date pregnancy from the first day of the last menstrual period, meaning gestational age. Generally begins about 2 weeks before fertilization in a typical cycle. If you didn't know any of this before today, that's exactly why we're having this class. I have felt the need. It has been impressed upon me. We've had other things on the Monday Master classes that have been very much just as important, but now we've moved on to getting to do a part 1 and part 2 because we have this on the schedule. We have this ready to go, okay? Because you shouldn't be embarrassed about something that nobody ever properly taught you. So next Monday, we're going to continue with Pregnancy 101. Part 2 is going to be about miscarriage, ectopic pregnancy, and abortion, what those medical terms actually mean. And we're going to discuss spontaneous abortion, miscarriage, medication abortion, procedural abortion, ectopic pregnancy, why ectopic pregnancy can become life-threatening, why an ectopic pregnancy cannot currently be transferred into the uterus, and also what treatments physicians may use. Okay, we are going to discuss it without yelling, without political memes, and without assuming everybody already knows the terminology. We're just going to have some education, just time for education. So if this class helped you understand something you've wondered about, share it, subscribe. So there is probably someone in your life who was never taught this either. My Gen Xers, where are we at? We knew that the baby boomers had a self-care deficit. We knew that we had to drink our water hose water, tie our bootstraps, and figure it out ourselves, right? Well, share this information with a fellow Gen Xer, a fellow open-minded baby boomer, right? That just is like, I don't know, maybe I'm curious now. Maybe my mind is wide open and I would like to learn, right? So just remember, education gives us the ability to ask better questions, and better questions help us make informed decisions. I love it. So, all right, I will see you all next Monday.